I'm excited to announce that just last week, the government of Rwanda announced a massive expansion of the Zipline service. So we will be expanding our services to reach every hospital in the country, as well as the health centers. So we're going to be going from reaching 21 hospitals to over 400. And as part of this expansion, we're also going to be looking at what are the other products that are needed besides blood. We're going to be expanding our service to include emergency vaccines, emergency and essential medicines, and also specialty products. So as you think about this, I invite you to imagine, what could this mean for urgent care if every time you had a patient who presented to a health facility in a case of an emergency, they could receive exactly what they needed, whether that was a snake bite or a rabies, need the rabies vaccine. What would this mean for universal access to primary health care if we were able to completely eliminate stockouts in every health facility across the country? And what would this mean for specialized healthcare if you were able to deliver the treatment that patients need to their closest health facility rather than requiring them to travel into the capital for care? So I'll leave you with one last thought. At Zipline, we've been preparing behind the scenes to really scale up our service. And we've been doing a lot to think about what are all of the different engineering aspects that we need to achieve in order to make this possible. One of the numbers that I'm most excited about is 4 days. And that's because this is the amount of time that it now takes us to deploy a distribution center. And that's down from 60 days 2 years ago. So 60 days down to 4 days. So as one final thought, I would like to invite you to imagine, how can emergency response be transformed around the world if we're able to bring on-demand aerial relief to communities that are affected by pandemics and humanitarian disasters within 4 days, no matter where they occur?